Like continue that because it just felt like the chamber.
I tell you, I think that Michelle, I haven't had a chance to talk to the president about other stuff, but I think now that they're promoted, I think she should look at that.
Yeah, she'd be perfect over there. I brought that up, and I brought that up to Mark too. I said, you really gonna be screwed if that happens. You're really screwed.
All right, hello everyone. It is 11 o'clock. I am going to give folks just a few more seconds to join the meeting before we get started. But if I could ask all participants to mute their microphone, and we'll get started here in just a few minutes. All right, thank you all for attending part 3 of the NEHA AEC 3-part virtual series, and welcome to today's session, Collaborating to Bring COVID-19 Resources to Early Education. All attendees are encouraged to participate during the session by submitting questions through the Zoom chat during the session. If you have additional questions after the session, or if you want to continue the discussion, please use the chat function on the session page where you entered this meeting on the virtual conference website, as the Zoom chat will no longer be available. At the end of the session, please complete the brief survey in order to receive the automatic CE tracking email for each session. A CE tracking email summary will be emailed to attendees after part 3 concludes. Without further ado, I'd like to introduce our speakers for today's sessions: Kathy Zhang with ATSDR, Nick Porter with ASTO, and Christopher Walker with NEHA. Kathy, take it away.
Hi, and depending on your time zone, good morning or good afternoon. And thank you all for joining today's presentation on the work of the COVID-19 Early Care and Education, or ECE Collaborative. As Jordan has said, my name is Kathy Zhang, and today I will be joined by my colleagues, Chris Walker with the National Environmental Health Association and Nick Porter with the Association of State and Territorial Health Officials to discuss this collaborative effort. Next slide, please. As we all know, early into the COVID-19 pandemic, there were many questions and lots of misinformation about safe cleaning and disinfection practices to prevent the spread of the virus. This confusion demonstrated a clear need for consistent guidance and best practices to protect children's health in the places where they live, learn, and play. Clear guidance was especially necessary for ECE facilities, where many children spend a majority of their active day and may be at increased risk for exposure to COVID-19 and other environmental health hazards. Next slide, please. To meet this challenge and to provide a unified voice for early care and education-related guidance, the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry provided funding and support to establish the COVID-19 Early Care and Education Collaborative. The Early Care and Education Collaborative, coordinated by NEHA, served as a forum to bring together key environmental health organizations, each with their own specialization, to better coordinate activity and messaging during the pandemic. Convening a broad range of organizations ensured that messaging was both consistent and targeted to a wide range of early care and education stakeholders, including ECE facilities, home-based childcare settings, clinicians, and public health organizations. Collaborative members worked to identify needs and, in response, developed educational materials, webinars, trainings, and other resources on priority topics, including safe cleaning, disinfection, ventilation, and food handling during COVID-19. Collaborative members also created tools for engagement and relationship building between ECE and health departments that can be carried on in a post-pandemic environment. Next slide, please. We conceptualized this collaborative to model key health in all policies, also known as HIAP strategies, and those are specifically highlighted in blue. This helped us to coordinate more quickly due to the urgent need for new information. HIAP principles allowed us to quickly divide and conquer activities and to also maximize the investment and stewardship of taxpayer dollars. It also helped to create consistent and synchronized messaging. Next slide, please. Since each organization represented a specific public health or childcare sector, we worked to create a simple matrix that stated each organization's role, responsibilities, and activities, and then shared them among all the other partners. We then developed a simple shared reporting tool to keep track of upcoming events or release dates of materials, and also captured shared metrics to understand impacts. NEHA served as the lead to convene the forum and develop the monthly agenda. They also maintained the tracking of partner documents and launched the COVID ECE website that houses fact sheets and resources that our collaborative partners have created. We held monthly virtual meetings with a similar format and primarily shared updates from each organization, discussed how we could best promote partner work, and talked through any concerns or challenges any one of our partners are facing. Next slide, please. With ATSDR funding this collaborative, I would like to provide some brief background on our organization. Mandated by CERCLA in the 1980s, the Agency for Toxic Substances and Disease Registry was created to serve as an independent health arm of the EPA. Along with Atlanta-based headquarters staff, ATSDR has staff in 10 regional offices across the nation. ATSDR conducts health consultations and public health assessments at hazardous waste sites and plays an important role in the community. We develop scientific materials on toxic chemicals and educate providers and the public. In this case, ATSDR received COVID funds for the purpose of supporting safe cleaning and disinfecting in schools and ECEs. Next slide, please. ATSDR responds to requests from the EPA, state or local agencies, and residents to investigate potentially harmful contaminants in the community. We fund 28 state environmental health departments to protect communities from toxic chemical exposures. And with that, I will now pass it on to Chris, where he will speak on our collaborative's convening partners.
Thank you, Kathy, very much. Next slide. Now we will share the organizations who partner with us in this project to provide resources to the ECE stakeholders. Next slide. American Academy of Pediatrics was one where Pediatric Environmental Health Specialty Unit is a program under this umbrella. The PACU program is the leading national source of medical information and consultative advice on environmental conditions at the vulnerable stages of reproduction in pediatrics. Another partnering organization was Association of State and Health Officials, ASTO. They are there for helping state and territorial public health agencies building their capacity to respond to environmental public health challenges. Another organization was Children's Environmental Health Network, also under the Eco Health Child Care. Their mission was to protect the developing child from EH hazards and promote a healthier environment. Next one would be the National Association of County and City Health Officials. They are serving local health departments where professional resources and programs are provided and seeking health equity. Next organization was National Center for Health Housing. And their mission is transforming lives by transforming housing, reducing the health disparities by translating credible science into tools. And of course, NEHA, where we are mission is to build and sustain and empower an effective environmental health workforce, where NEHA believes that the professional who is educated and motivated is the professional who will make the greatest contribution to the helpful environmental goals which we all seek. These organizations came to the table to develop ways to protect children and early care education workforce. Next slide. We are proud and excited to share with you the resources that were developed from this collaborative. A lot of hard work was put together, a lot of collaborative, a lot of behind the scenes to reach out to these organizations, reach out to children as well as ECE facilities in order to provide this resource to help build them up dealing with COVID. Next slide. One thing that was created, which Kathy had talked about, was a resource web page. This COVID-19 ECE resource web page on the NEHA website was developed, meant to be kind of a one-stop shop for ECE stakeholders. There are different links dealing with fact sheets, webinars, trainings, and other resources. Next slide. We also want to share the work that was put in by these wonderful organizations. There were different types of resources, which include webinars, fact sheets, infographics, assessment documents, videos, resources in Spanish, and other resources. When added the number of resources all together, we currently have a total of 40 resources, and that's a minimum of 40 because we're still putting some resources together. This is awesome, an awesome testament to the work by the organizations, an awesome testament to how the collaborative worked and how we came together to meet this need to address the gaps dealing with ventilation and sanitization in ECE facilities. There are still more resources being developed, but we are so proud of the work and commitment by our collaborating partners. Next slide. We are going to begin with highlighting some of the webinars developed. The Pediatric Environmental Health Specialty Unit, PESU, put together and hosted a mini-series of 4 webinars focused on safer disinfectant use. We know people were using more chemicals during the COVID-19 pandemic, but still needed to be educated on using it in a safe way. Misuse of disinfectants can cause health issues. So this was an opportunity to educate those people. Next slide. National Center for Healthy Homes also hosted a webinar for cleaning and disinfecting in the home. So that was something where we wanted to make sure that we were able to provide resources for ECE facilities, as well as home childcare facilities to where they were able to have these resources and be educated as well. Next slide. Now we're going to talk about some of the guidance documents and infographics that were created. Next slide. This document right here was created, this was a fact sheet that was created by the Children of Environmental Health Network, dealing with safe, cleaner disinfecting in childcare facilities. If you look at it, you can see different schedules when it comes to cleaning and disinfecting, the use of, make sure we're choosing not to use enough pump sprays and not aerosols, as well as choosing certified green cleaning products. Although we are using chemicals, we want to be mindful that a lot of chemicals that are used are harmful to the environment. So we always want to promote safer options for chemical use, as well as different fact sheets on items mouthed by children not being disinfected, soft and porous materials. So this was a fact sheet that was created by Children's Environmental Health Network. Next slide. The infographic on the right was created by National Center for Healthy Homes, valuable healthy homes resources for home-based childcare providers. So this was a lot of information dealing with, toolkits, healthy homes, eco-healthy childcare best practices, environmental health and COVID resource libraries. And one thing that was created that was really interesting was from PESU. They created a comic strip for families and for children, just to see how germs are spread and how to keep themselves and their family safe. Next slide. And even with all of the fact sheets and infographics that were made, we were also mindful that we didn't want to just provide this information in English. This is a fact sheet created by Peisu, dealing with safe disinfectant, but it was put in Spanish. So this was something to provide to Spanish speaking, Spanish reading population, in order to give them the opportunity to have something that was readily accessible to them. Next slide. Now we will talk about the assessment form and checklist. Next slide. This form was put together, primarily it was meant for the EH workforce. As some of you may know, when we EH workforce sometimes regulates child care facilities. So this was an assessment form just to do, instead of a detailed inspection, just the ability to make sure that those child care facilities, child care centers, had the tools and resources that they needed in order to have a safe environment. So you see the listings as far as facility and classroom, air filtration, children, ventilation, housekeeping, cleaning, chemicals. And this was something for the EH workforce to use, but also even within childcare centers, there is a useful tool for them to use as well to routinely do a check of their facility to make sure that they're safe, that their ventilation is working properly, that they have all the equipment needed to help protect themselves and protect the people that are there and the children that are there within their child care facility. Next slide. Now, this checklist was developed during our check-in meetings with Children's Environmental Health Network. One staff member shared that there was currently no checklist at the time dealing with ventilation for child care facilities. So we decided to assist by putting together a simple checklist just to give child care providers items to look at daily to improve airflow indoors in a safe way. We also included chemical usage and air filtration in the checklist. So this was something that child care centers can use, and they can use it weekly, but you also see that there's monthly and quarterly input that you can put in there dealing with air cleaners and filters and air filtration. So we were very proud to share that resource with childcare facilities. Now with that, next slide, I'm going to give it over to Nick Porter.
Great. Thank you so much, Chris and Kathy, so much for that. Hi, everyone. My name is Nick Porter, and I'm a director for environmental health here at the Association of State and Territorial Health Officials. And so for those of you who may not be familiar with ASTO, we are the membership association for the 59 state, territorial, freely associated state and District of Columbia health departments and the staff that they employ. So we support the state health officials and their staff. And so today, I just wanted to talk a little bit about one of the resources that we pulled together as a part of the ECE collaborative. And you'll see on this slide here, the Indoor Air Quality in Early Care and Education Facilities issue brief. And so this was developed, again, as a part of the ECE collaborative and really provides strategies for mitigating airborne transmission of SARS-CoV-2 in ECE facilities. It pulls from various state examples of indoor air control strategies, and it's kind of based on the hierarchy of controls framework, which I'm sure many of you are familiar with from occupational health settings. I know it's a little bit hard to see on this slide, but on our document, we had a graphic of that hierarchy of controls, and it kind of goes from most effective to least effective in terms of ways to control hazards. And it includes links to kind of the key resources and guidance that informed the development of the brief. And so a lot of the kind of the strategies that were pulled into this 2-page brief were based on guidance from CDC, EPA, and ASHRAE, as well as the American Industrial Hygiene Association, as well as our state health agency members that we kind of pulled info and had conversations with as a part of this. Some of the examples that are included in the issue brief are, for example, engineering controls such as, utilizing improved ventilation through utilizing outdoor spaces and opening windows or doors, especially, when appropriate, given the outdoor temperatures, to promote natural ventilation. Also talking about kind of considering consultation with an HVAC professional to optimize outdoor airflow, control indoor humidity, and other things that can affect indoor transmission. We also touch on examples of kind of administrative controls that ECE facilities can use, such as grouping students into cohorts or pods and limiting kind of those cross-pod or cohort interactions, increasing time between activities and creating physical distance between desks and utilizing assigned seating, as well as reducing activities such as singing and vigorous exercising. Next slide, please. And so, we created this issue brief that, was kind of chock full of different information and resources and guidance that we had pulled together, and then worked pretty hard to disseminate it through our various channels here at ASTO to make sure that we were able to get the word out. We utilized various newsletters and publications that we put out on a regular basis. So you can see here that we have our COVID-19 daily brief that we were able to disseminate this in. The daily brief is since moved to a weekly publication format, but initially it was a daily newsletter that ASTO staff pulled together that included various updates and need-to-know information related to the COVID-19 pandemic, and it was really aimed at our state and territorial health official members. It also included resources developed by ASTO and our partners, events and other information. We also disseminated it through our environmental health bulletin, which is a bi-weekly newsletter that ASTO's environmental health team publishes. And this is, similar in format to the COVID-19 daily brief. However, it's focused primarily on environmental health issues, news, resources, guidance, and events. And then finally, we utilized our Public Health Weekly, which is kind of ASTO's flagship newsletter that goes out to over 85,000 public health professionals, and includes resources, general public health resources, but obviously over the past year and a half has focused almost primarily on the COVID-19 pandemic and associated factors. So, included our issue brief there. We also have a COVID-19 resource hub on our website that we were able to post it on. This resource hub features different guidance, documents, resources, partner resources, developed by ASTO and with our partners, and kind of goes by specific topics related to the pandemic. So we posted it there. And then ASTO also convenes a peer group called the State Environmental Health Directors Peer Network, which is made up of the kind of environmental health management officials in state and territorial health departments. And so we were able to disseminate it there through email, through that listserv, as well as an online community that we manage as a part of that peer group. And then obviously we sent emails to our partners and funders, including members of the ECE collaborative, and made sure to disseminate it that way. And in that first month since it was published at the end of May, we had 5,361 downloads, which we were pretty pleased with, and I'm sure it's gone up since then, hopefully. Next slide, please. And then finally, just wanted to talk to you about another initiative that ASTO had been undertaking this past year and was part of the ECE collaborative. And this is our Apple Tree COVID-19 supplemental mini grant program. And so for those of you who may not be familiar, and I know Kathy had touched on it a little bit earlier during her overview of ATSDR, but essentially, Apple Tree is the Agency of Toxic Substances and Disease Registry, or ATSDR's, kind of flagship cooperative agreement program. It funds 28 state health departments and helps build their ability to evaluate environmental public health issues, and specifically primarily deals with responding to health issues related to hazardous substance exposures at specific sites. This program, funds the 28 state health departments to do activities such as identifying exposure pathways, providing education on hazardous exposures and these chemicals, as well as evaluating the link between, or the potential link between health outcomes and hazardous substance exposures. And so earlier, or midway through 2020, ATSDR provided funding to their supplemental funding to their grantees, and through our partnership and our cooperative agreement with ATSDR, we were able to fund 5 additional states through these mini grants. And so those 5 state health agencies or their partner organizations are listed here. We worked with Kentucky, Indiana, Informed Green Solutions, which is the partner for the Vermont Department of Health, Virginia Department of Health, and the Arkansas Department of Health. And so through this program, we were able to provide $60,000 in funding to each agency or organization. And again, really the purpose here was to assist these 5 agencies or organizations in their environmental health related COVID-19 response activities. So that was anywhere from safe disinfection practices at home, school, and ECE facilities. It could have been used to conduct environmental assessments at ECE facilities or other businesses that are regulated, such as restaurants, strengthen partnerships among the environmental, epi, and laboratory response arms, as well as preparing for natural disasters during COVID-19. And so just some kind of quick examples of some of the work that was conducted specifically by the states that we funded under this. Vermont Department of Health and their partner, Informed Green Solutions, they work to host virtual meetings and workshops with K through 12 schools, as well as early care and education programs to provide info on safe and effective COVID-19 mitigation protocols, including protecting their students and staff from harmful chemical disinfection exposures, disinfectant exposures rather. So kind of similar to some of the green cleaning ideas that were talked about earlier. And then the Kentucky Department for Public Health, worked to develop guidance and education materials for K through 12 schools on, again, the topics of safe disinfection, safe reentry, and planning for future emergencies. And then finally, Kentucky also updated guidance for chemical and radiological emergencies with considerations for COVID-19. Some of the other states, they kind of kept some of this focus on the K through 12, but also the K through 12 and the ECE facility sort of angle, but they also expanded out a little bit more and looked at providing guidance to restaurants and also sort of providing assessments for, different gatherings and things like that were occurring within their states. So anyways, that is just about all I had, and I will pass it back over to Chris. Thank you so much.
Thank you, Nick, for all of the work that ASTO has done and supporting the state jurisdictions. Next slide. Now we're going to share a resource listing of all of the resources that were created. And if you look at the slide, you can see the different webinars. And I do want to put in a plug for Apple Tree COVID-19 supplemental project presentations. That's actually coming up. That's going to be July 26th at 3 p.m. Eastern time. So that's something to put on your radar if you're interested. But some of the other fact sheets, of course, safer disinfecting in childcare facilities, healthy homes, guide to safe cleaning, even fact sheets on hand sanitizers. Next slide. Some of the infographics that were shared, some environmental health workforces may not go to have access or have been regulating childcares. So we decided to create some infographics, just simple items dealing with cleaning and sanitizing toys, diaper changing best practices, food prep and servicing for the EH workforce. Just something that they can use to feel confident whenever they go into these ECE facilities. As well, we have some indoor air quality, safer disinfectants. We have the resources that are in Spanish. So we had talked about that earlier, that we converted a lot of these resources to be in Spanish for the ones who primarily speak and read in Spanish. Next slide. We even had some videos. That was very interesting, where we're choosing and using disinfection products, healthy housing, dealing with ventilation, as well as some other resources dealing with green cleaning and ECE facilities. We also have social media marketing tools. And one thing to be aware of that we'll highlight, Choose Safe Places, is dealing with making sure that in ECE facilities that they're mindful of EH hazards during a particular disaster. So these are wonderful resources that can be used now during the pandemic, but even beyond the pandemic, when COVID hopefully is long gone, we have these resources that can still be used and are still relevant, after a pandemic. Next slide. One thing that we wanted to share is the fact that we looked at the data metrics of the resources that were shared through webinars, infographics, fact sheets, social media, and we're so proud to share, next slide, or stay right there, that over 590,000 people, 590,000, I'll make sure I got it right, people and organizations, next slide, were connected with this resource. So we were extremely happy that we were able to connect these resources with so many people and organizations. That is a testament to just the work that this collaborative put into providing and being serious about providing and empowering ECE stakeholders with the tools to help them deal with and protecting against COVID-19. So like I previously said, although these resources can be used now, these are resources that can be used for a very long time, that can be used into the future beyond COVID. So this is something where we want to make sure that we are empowering, that we are making sure that each stakeholder has the right tools to be able to be successful, to be able to educate where they're protecting themselves, either through regulation or through work, as well as protecting the children who they are providing the service to. Next slide. And one thing we wanted to highlight also is just the importance of this collaborative. This is a very unique situation where different organizations are coming together and identifying environmental health needs. That's something to where we knew that there was a need. There was something, especially during a pandemic, where there were very little to no resources provided. So we, as a collaborative, were mindful of those things, where we were focused on the goal of protecting the health of children, that we were focused on the goal of protecting the staff who were working with children. Because protecting children is one thing, but you have to have the staff. If you don't have the workforce, it's kind of hard to even provide the service for children. So that was something that we were mindful of, that we wanted to make sure that we were able to fill in as many gaps, that we were able to stand in the gap to be a resource to facilities, to homes, to regulators at the state, local, tribal, territorial level. So we were able to meet that public health challenge in real time. So sometimes it was trying to figure out what to do, what type of resource to create, but also that's where those challenges came in. But that was the benefit of the collaborative, where we were able to come together And if there was a particular need or a particular challenge, that was something that was the opportunity to put it out there, to voice it to the rest of the partners, to where some type of assistance can be provided, some type of advice can be shared, in order to know that, although we have our own separate organizations, this was a group effort. This wasn't just one organization. This was all of us working together for the common goal of protecting children, as well as the ECE stakeholders that were involved. Next slide. Now, this is where we need you. This is where you can play a major part. We are happy about the number of people and organizations that we were able to connect these resources to, but we know that many were not able to gain access to these resources, or were not able to be connected. So we would love your support to help get these resources to ECE stakeholders to protect children and the providers that care for them. So with that, we do have those links or those resource listings that were provided. A PDF file was created, and that you should be able to access that as you exit out when you kind of click on our particular link to this presentation. There's a PDF form, and all of those links should be live. So feel free to connect to those links. Feel free to click on it. Feel free to share those with as many ECE stakeholders as possible. We want to continue to get the word out. We want to continue to get this information out, because right now, COVID is still here. So we want to be mindful, and we also want to make sure that we are protecting and empowering our ECE stakeholders. Next slide. So what's next? We will continue to re-promote these resources to early care and education stakeholders, child care, licensing organizations, regulators from state, tribal, local, territory jurisdictions, and any other supportive organization. We will also continue to update the resource webpage to make sure that the available resources are current. We want to make sure that any changes, any updates that are provided federally, that we are able to update our content to make sure that we are providing current and up-to-date information. Next slide. Now, if you are not already doing so, please follow us on Twitter, Facebook, and/or Instagram. You can see the tags available on this slide. This is one way we are advertising these resources through social media. You can also find other useful information through the websites, but this is one way that you can find different information, not just COVID related or ECE related items, but different items dealing with our particular stakeholders. Next slide. Now, some upcoming events that are coming up, or where we plan to re-promote these resources. One will be National Preparedness Month, which is the month of September. So that's an opportunity for us to re-promote, to highlight these resources again. We don't want, sometimes when you see resources, you see them once and then you get a whole bunch of emails or a whole bunch of content, and now they're at the bottom. So we always want to make sure that we're keeping this information up to date. We want to make sure we keep it available so that it gets to the right people. Next slide. Another event that is coming up is Children's Environmental Health Day, which is October 14th. And this is every year. It's the second Thursday in the month of October. So we want to make sure that we have the opportunity to promote resources and help build and help support Children's Environmental Health Day in October. Next slide. With our acknowledgements, as we come to a close, we want to acknowledge that these activities were supported by the cooperative agreement funded by the Centers for Disease Control and Prevention, Agency for Toxic Substances and Disease Registries. Its contents are solely the responsibility of the authors and do not necessarily represent the official views of the Centers for Disease Control and Prevention or the U.S. Department of Health and Human Services. Next slide. We thank you all for allowing us to share this great work from this collaborative. We are very proud. We are thankful to have come together. This is the end of the presentation. So if there's nothing else, we will now be accepting questions. So thank you very much for allowing us to share this.
Thank you all so much for your presentation. That was wonderful. I would like to encourage people to drop their questions into the chat and I'll ask those, but we do have a couple to start with. How did the collaborative decide what topics to focus on for the resources that were developed?
I'm happy to kind of, Chris, if it's okay, I could talk about
go ahead, Nate.
Absolutely, sure. Thank you so much for the question. So I think for the ventilation brief that we had developed as a part of this collaborative, we regularly talk and hold meetings with our state environmental health directors peer group that I mentioned previously, and throughout the pandemic, starting from last March through the present. We were kind of periodically checking in through various, monthly calls or, small short surveys asking for resource needs or guidance needs or things that folks were interested in learning more about that they needed a little bit of assistance with in terms of pulling resources together. So I think that kind of drove the decision for us to create and focus on that resource. Again, I mean, I think we kind of keep in regular contact with our members and really try to just meet their needs. And so that was a reflection of that.
Wonderful, thank you. Chris, do you have anything to add?
Yes, and one thing that I can add on that as well, of course, we were always mindful of kind of our target audience within the organizations. So one thing, we did reach out to some of our stakeholders and see what's the need, where's the gap, where can we support. So, and that's where a lot, we had some, I guess, powwow meetings where we would just kind of listen in to see, what the need was for, especially even childcare facilities. So that was something where, I guess from the horse's mouth, we want to kind of get the answers. So we would bring these items back to the collaborative. We would kind of have our own internal check-in meetings with Children's Environmental Health Network or National Center of Healthy Housing and figure out where we can support. So it was something where it was difficult to kind of figure it out in the beginning. But as time goes on, you see the need. I mean, of course, I guess the low-hanging fruit was kind of cleaning and disinfecting and sanitizer, and sometimes the misinformation of those things. So that was something that we were able to, we saw the need and we were able to create different resources in order to meet that need.
Wonderful, thank you. Kathy, do you have anything you'd like to add?
Sure, but I think that, Chris, Chris and Nick did a really good job. But, the collaborative members, they are part of like national organizations, and their membership represent a wide variety of environmental health stakeholders. And so I think that the collaborative members, they base the resource development on any of the feedback that they have been observing or that they have gotten from their respective organizations and membership. But I think Chris and Nick did a pretty good job in summarizing that already.
Wonderful, thank you. Another one, what are some challenges, barriers, and successes that you encountered in pulling this group together and focusing efforts on a single, albeit broad topic?
I can take a stab at this. It was a lot. So, I mean, it's one of those things during the pandemic, you want to act fast, but yet you want to be accurate in the way you do act. So yeah, you don't want to just give out half information. We have to do our research. We had to see where the challenges, where the gaps were, and we didn't want to reinvent the wheel. We didn't want to have the same tire 5 or 6 different ways. We wanted to make sure we were mindful of our different environmental health stakeholders. We were mindful of what needed to be done at the house, what needed to be done at a facility, and what needed to be done maybe from a regulation standpoint. So I guess the main thing was just trying to figure out how we wanted to focus. So, and I think that's where the collaborative was really important, because I think we can always do broad and we think, okay, we're changing the world, but also I think it was something that we want to be mindful. Okay, sometimes changing the world is, one piece at a time. So we had to kind of, of course, the broad type thinking, but to bring it in to make sure that we're still kind of addressing the needs that we're supposed to be meeting. And that was something even towards, I think maybe towards the middle part or the second half of the project, we were talking more about ventilation. Ventilation wasn't something that was really brought up necessarily in the beginning part. It was kind of surface cleaning and disinfecting. But you start learning more about ventilation towards the second half of it. So that was something where we had to, okay, there's a need there. So we wanted to provide that need. So that was something that I'm just very appreciative just of the collaborative. I think everyone was very flexible, the ability to kind of think outside of themselves and kind of think of the bigger picture to provide these resources to the ones who are in need. So Kathy or Nick, they feel free to add anything on that.
Yeah, sure. I mean, I can add a little bit there. I mean, I think many of the organizations that took part in this collaborative, are membership associations or organizations, right, representing the public health workforces in the various, aspects or jurisdictions, right? And so I think one of the things that we always struggle, even before the pandemic, struggle with was making sure that we're balancing, sort of pinging our members and asking them questions while at the same time keeping in mind that they have their day jobs to do, right? And so, fast forward to the pandemic, when you're trying to gather information about what might be useful for our members, and folks are busier than they've ever been in their careers, both professionally and in their personal lives too, just, dealing with the pandemic on a human level. We really kind of, I think, were tried to be pretty thoughtful about, where we were, having those touch points and tried to make it as easy as possible to gather that information back from our members. And I do think we learned a decent amount about, ways to do that, quickly and effectively, that we can take forward into the future to kind of better serve them. I think also, it was a challenge, and I think also a success in the fact that everyone was very busy, but we still took that time to meet on a regular basis and ensure that we weren't working over each other or duplicating work, or that we were complementing each other, and kind of providing that united front in terms of the information that we were sharing, and sort of, again, just, I think, really sort of collaborating in making sure that we were serving our members in the public health community at large as best we possibly could. So.
Kathy, do you have anything you'd like to add?
Or I could just add something pretty brief. Because once again, like I think Chris and Nick does a really good job in, providing this information. But even with the challenges, that the partners in collaborative may have faced regarding like information, like changing information, staying uniform, and messaging, even with those challenges, we persevered. We were able to, like what Chris mentioned, over 590,000 people and organizations were notified, and also tuned into the resources that our collaborative members have created, which I think is incredible. And so that's a huge success, that we were able to reach a wide variety of environmental health and ECE stakeholders to ensure that all who are involved in children's health at these ECE facilities were informed of these resources and tuned in. So I think that was definitely very awesome, and something that, I'm really proud. I'm really proud of this collaborative for doing.
You should be. That's very impressive.
And one thing, Jordan, if I can just add,
Please.
just with, I have yet to meet anybody physically. I've only seen virtual. So the fact that we were able to do all of this virtually, and to brainstorm, to come together, and we're all in different locations, but the ability to do that is amazing. You talk about, where we have gone with Microsoft Teams or Zoom, before COVID and during COVID and hopefully after COVID. So just the ability to connect with people that you would not normally be able to connect with, I think is a total success to show that we can look past kind of outside our backyard and see people in other locations, other states, even other countries, to see how we can kind of all support each other and create resources.
Yeah, Chris and Kathy, I look forward to meeting you soon.
Okay, let's do one more. We've got a few more minutes. What advice would you give other organizations or agencies who are interested in starting a partnership or collaborative to focus resource development on a specific public health topic?
I can go ahead and start. Chris, is that okay? Or I saw
Sure,
you about
go ahead.
to.
Go
Okay,
ahead. Go ahead.
okay. I'll kind of go back to what I was saying a little bit before about, I mean, at least I kind of approach this from a membership association perspective, but just making sure that we're being cognizant of the needs of our members and their staff. I think, this obviously this pandemic was an unprecedented public health emergency, at least in our lifetimes. And, I think we were very, cognizant of that and did our absolute best to gather those needs of our members and then, disseminate that information within the collaborative and kind of make that known, because I think, we all sort of brought the needs of our respective memberships to the table, and then we're able to kind of go from there to create the myriad resources that we did and, create them in an effective manner that would be as useful as possible to the folks that we serve. So that's sort of the angle that I approach it from, is really trying to drill down into what are the needs and then effectively meeting those needs.
Yes, and those needs, but as well, plan, put something on paper. Feel free to kind of look outside of yourself. One thing that I've kind of gleaned from this is we can find the answer together. That all you have to do is just kind of reach outside of yourself. So if there's an organization, whether locally or state or regional, feel free to connect. Worst case scenario, they just say no, I don't have the time. But when you kind of come up with a particular topic or you kind of point out there's a need, it's very hard for an organization, me personally, to think that they would just say no. I mean, because there's a need, and like I said, to be a part of something kind of greater than yourself is very rewarding. So that's, I mean, you plan it, you try to set it up. Of course, you look big picture, but then kind of bring it in to see, hey, how can we, fine tune, where can we pinpoint, this resource or this need in your own backyard, and then that's kind of how you see how it, is a value to you as well as to the others who are part of it.
And I guess if I could just add one additional thing to that, Chris, I think also, making, sort of drawing kind of similar to what you said, drawing on those existing partnerships that you have. And then, kind of, it sort of, to me, showed the importance of having those relationships and those partnerships established, prior to being in an emergency response situation where you're scrambling to figure out, what you're trying to do and what you're going to be creating in terms of resources. So, I mean, I'll just say we at ASTO had pretty good relationships with everyone, most everyone in this collaborative already. So it made it much easier for us to coordinate and collaborate already, with those existing relationships. So.
Sure. Well, thank you.
Can I just add one last thing?
Please.
I think, like Chris and Nick both brought up like great points about partnership that that's something that I would like to just kind of add on a bit. So, this experience has really shown us how like cross-sector partnerships, how they can be rapidly established in response to a public health crisis such as COVID. And so these types of partnerships, are beneficial, both just, regular day early health practice or even in emergencies. And so I guess advice would be that for those, who are interested to find ways to incorporate the health and all policy strategies into their work. And there are many, HIAP strategies and resources out there, as well as collaborative efforts around HIAP. So, if you're interested, I can definitely drop some links in the chat box on these resources. But I think that, that's the HIAP has definitely been really beneficial for this type of cross-sector partnership.
Great. Well, thank you. And if you can drop those resources in the page, the session page on the Pathables website, that'd be great, because that chat will disappear as soon as we end this presentation. But thank you so much. That was awesome. We're getting some feedback in the chat that everyone really enjoyed it. So I really appreciate your time. And I'd just like to encourage everyone to go over and visit the expo booth, as well as take advantage. We have a virtual photo booth that's kind of fun. So thank you so much, everyone, for coming, and enjoy your afternoon.
Thank you.
Thank you. Take care.
Thank you.